Religion and healthcare have been linked throughout human history. The earliest hunting and gathering peoples believed that illnesses, both mental and physical, were caused by evil spirits, demon possession, or other spiritual forces. The earliest specialists in the healing arts are known by various names such as shamans. Shamans are said to treat illness by traveling to spirit worlds to bring back lost souls and to remove any evil spirits that are possessing or attacking the sick person. Humans started living in larger, organized groups around 12,000 years ago. Many of these civilizations developed institutions dedicated to caring for the sick, such as these Egyptian temples. Egyptian and Mesopotamian priests were believed to have magico-religious healing powers. In ancient Greece, temples that were dedicated to their healer god Asclepius functioned as centers for medical advice and healing. Later, with the development of Christianity, healings were attributed to Jesus, who healed with the religious power to forgive sins. The first residential hospital in Western civilization was built in Asia Minor around 370 AD by Saint Basil, following the biblical injunction to clothe the poor and heal the sick. Diseases were studied, and physicians and nurses treated sick patients there. Physical and spiritual healing practices played an important role in the transmission of Buddhism throughout Asia. The first residential hospital in China was founded in 491 AD by a Buddhist prince. This is an image that is often called the medicine Buddha. In the West, from medieval times to the Renaissance, virtually all physicians were drawn from monastic communities, and care of the poor and sick was provided primarily by the Church. Here we see the Hôpital de la Charité in Paris, founded by a Catholic order. Jean Achterberg, a research psychologist who has studied healing across cultures, summarized the long-term relationship between healthcare and spirituality this way. Medicine, as it has been practiced throughout history, is invariably linked to the divine. Healing work is a spiritual practice. It always has been, and it always should be. With the advent of spectacular scientific discoveries, starting in the 18th century, the separation of medicine from religion began. In France, Napoleon, as its emperor, mandated that hospitals and medicine be independent of the Church. Technological advances of the last century tended to change the focus of medicine from a caring, service-oriented focus to a technological, cure-oriented focus. In psychological theory and practice, religion and spirituality have been ignored or pathologized by such pioneers in the field as Sigmund Freud, who described religion as, quote, a system of wishful illusions together with a disavowal of reality such as we find nowhere else, but in a state of blissful, hallucinatory confusion. Albert Ellis, the founder of rational emotive therapy, which is a precursor to cognitive behavioral therapy, viewed religion as equivalent to irrational thinking and emotional disturbance. Quote, the elegant therapeutic solution to emotional problems is quite unreligious. The less religious they are, that is, patients, the more emotionally healthy they will tend to be. End quote. B.F. Skinner, one of the founders of behavioral therapy, made a point of ignoring religious experience in his scientific writings, but in his novel Walden 2, about a utopian society, Skinner described religion as, quote, an explanatory fiction of a miracle-working mind, end quote, and as a useless concept. He portrayed prayer as, quote, superstitious behavior perpetuated by an intermittent reinforcement schedule, end quote. That is, people sometimes do, by random chance, get what they pray for. We are in a new era where religion and spirituality are recognized as important aspects of human diversity that should receive adequate attention in multicultural competence training for psychologists. There is a growing consensus that all clinicians are, quote, ethically obligated to incorporate religion and spirituality into their practices, at least to the extent that they can ensure the competence of their services with religious and spiritual clients. Basic spiritual competency is necessary for all healthcare providers in order to deliver effective clinical services.